What is transcultural nursing? While the concept of transcultural nursing was established almost 70 years ago, its principles are more relevant than ever as the world becomes more diverse and interconnected. What is transcultural nursing exactly? Culture can influence healthcare in many different ways, such as how patients perceive their illness, whether they seek treatment, and how they respond to treatment. It may also influence what kinds of medications patients take or are open to taking. The term transcultural nursing refers to a nurse's ability to factor a patient's cultural background, including beliefs and values, religion, lifestyle, and family history, into medical care. Understanding and respecting a patient's cultural background and using that knowledge to develop a care plan is critical. It can have a direct impact on the quality of care delivery and ultimately the health of the patient. According to Cigna, culturally sensitive healthcare can help reduce many health disparities, including language barriers, medical biases, issues related to care access and quality, and low health literacy. Nurses are well suited to provide culturally sensitive care because of the profession generally approaches medical care from a holistic perspective, viewing the patient as a whole person rather than merely an illness or a set of symptoms. Also, because they are often the first point of contact for patients, nurses are uniquely positioned to provide culturally sensitive care at the earliest stages of treatment. History of transcultural nursing. Transcultural nursing first emerged as an area of study and practice in the mid-1950s, spearheaded by Dr. Madeline Lanier. Lanier, a registered nurse, developed the theory of transcultural nursing, also known as culture care theory, and wrote multiple books on that subject in which she laid out the principles of the theory and explained its practical applications. The three core principles that Lanier said nurses should follow to achieve culturally sensitive care are: cultural preservation or maintenance. Nurses work with patients to maintain patients' cultural values in the context of healthcare provision. Cultural care accommodation or negotiation. Nurses work with patients to adapt their cultural beliefs or values to a care plan in the interest of producing a positive health outcome. Cultural care repatterning or reconstructing. Nurses work with patients to reorder, change, or modify their way of life to improve their health conditions while still respecting patients' cultural values and beliefs. Transcultural nursing in rural and remote areas. Approximately 60 million people, roughly 20% of the country, live in rural America as of the 2010 census, according to the US Census Bureau. Due to various factors, populations in rural and remote areas are generally face more hurdles in accessing healthcare than their urban counterparts. Applying principles of transcultural nursing in rural and remote areas can help minimise the health disparities these populations often experience. Access to healthcare in rural areas. Residents living in rural or remote areas of the US often encounter obstacles that can limit their ability to get healthcare they need. For one, these areas generally have fewer healthcare facilities than do urban environments, and therefore fewer healthcare services are available. However, even if the health services are in steady supply, residents of these areas may experience other issues that impact their access, such as financial means. A lack of health insurance coverage or other means may limit residents' ability to pay for healthcare services. According to the findings of a 2019 report from the Robert Wood Johnson Foundation, 45% of adults in rural America said that they could not get the necessary healthcare because they are unable to afford it. Distance. Reliable transportation may be an issue in rural and remote areas where healthcare facilities are far away. After affordability, the most cited obstacle to healthcare in the report from the Robert Wood Johnson Foundation was distance and or inability to get to a healthcare location, with 23% of residents saying it prevented them from receiving needed services. Patients may also be limited in their ability to take time off work, especially paid time off, to receive services. Communication. Patients, particularly those who are not fluent in English or have poor health literacy, may lack the confidence to communicate with healthcare providers. Trust. Patients in these areas may be concerned about compromising their privacy by using healthcare services and about the quality of care they receive. Importance of nurses. Nurses are vital to bridging cultural gaps and the health disparities that they can cause. In many rural and remote communities where access to healthcare services is limited, nurses are often the primary care providers. A 2018 study by the Journal of General Internal Medicine found that nurses and other non-physician clinicians were more likely to practice in rural areas than physicians. Nurses in rural and remote areas also often live in the communities they work in and, as a result, have a better understanding of the culture of those areas and the issues impacting public health. Given the hurdles patients in these areas face, transcultural nursing principles are critical to overcoming health disparities. To ensure that they are providing culturally sensitive care, nurses can employ a few relatively simple practices, including the following. Establish clear communication. Nurses should understand their patients' preferred method of communication and arrange for an interpreter if necessary. Be aware of non-verbal cues. Nurses should be aware of the importance of non-verbal communication and how it can differ significantly across cultures. Ask about relevant traditions or customs. Part of the culturological assessment may include exploring spiritual or religious practices, dietary considerations, and cultural norms that may impact a patient's health situation. Nurses are often a patient's primary care provider, particularly in rural and remote areas where access to healthcare services may be limited, and play a vital role in culturally competent healthcare. Benefits of culturally competent healthcare. Exercising cultural competency in healthcare has numerous benefits. Its primary aim is to reduce the health disparities between patients of different backgrounds and help increase health equity. Achieving this can yield additional benefits on many fronts. Health benefits. An analysis by the Hospital of Pediatrics, a medical journal from the American Academy of Pediatrics, revealed that hospitalized Latino children were more likely to experience preventable adverse events than non-Latino white children, due in large part to language barriers. On the other hand, by working to minimise disparities, culturally competent care can ultimately improve patient health. It can increase patient engagement, improve the collection of patient data, reduce medical errors, and enhance preventative care and treatment adherence. Financial benefits. Culturally competent care can also help a healthcare organisation's bottom line. It can improve the efficiency of medical services, reducing the cost of medical care for providers, as well as minimise the risk of malpractice lawsuits resulting from misdiagnosis and medical errors. Nursing care often focuses on the preventative care, health promotion, education, and helping patients make better lifestyle choices. In doing so, nurses may be able to help patients reduce their own healthcare expenses, which is often a concern for minority patients and those in rural areas. Social benefits. Practicing cultural sensitivity can also increase trust in the community, which can be a significant barrier to health equity and may improve public health. A study by PLOS 1 indicated that Black patients at one primary care clinic rated their providers' behaviours and attitudes significantly higher after employees of the clinic underwent cultural sensitivity training.